The last speaker, Dr. Subhash Prasad, he will be speaking on if your children are ophthalmologists or medicos. And his daughter and daughter-in-law are ophthalmologists. Whether they join his practice or not is his biggest problem.
Good afternoon, and thank you, Dr. Rajanji, for including me in this IC, and thanks to the audience for sparing time in last session of the last day of the annual conference. So we all are growing. Many of us have come to the age of 60 years or more than that, where we are at the crossroad, where after having established some clinic or having established some hospital, now we have certain situation like our child, some of us who have married early, their child has grown up to the extent that they have completed MS, or some of them are in the medical college. But those who have actually, nowadays people are marrying very late, so for those it may again be more challenging. So I have a situation where my daughter is an ophthalmologist, son-in-law is an ophthalmologist, and son is doing MBBS. So what happens if your child are ophthalmologist or medico? You are always, now at this age of time, you start thinking that probably they will come and join me and make my life easier and will help my center grow. But does this happen all the time, or how does it going to happen, and what are your planning? So this is actually my thought and my experience. This talk is based on my experiences. This is basically Man Ki Baat. So many of this may be applicable to many of you. This can be just be replication in your own life also. So before coming to the next generation, let me introduce myself. I started my clinic in after having spent as assistant professor in RIO. Before that, did my post-graduation from Good Institute. I started my clinic in 2002, and now so over 22 years of my life in private practice. I started with very small investment, very small amount as corpus. So I tried to use that as and I invested in refurbished machine. Now certainly I am a busy practitioner if I look at myself, because I am busy all the time, and I've reached to a satisfactory level gradually, not overnight, but it took some time, and now earned a goodwill and created a brand. And now my center is equipped with one of the best available machines in the market. So currently I have a team of 6 ophthalmologists. Many of the ophthalmologists came, joined, then gained some name, experience, then left after gaining some experience and goodwill. So it's very difficult to retain in this era of multiple because we have the new generation have a lot of options like work in corporate. Lot of medical colleges have opened, many centers, ophthalmic center have come, so they have choice of joining those centers if they are academically interested or private establishment. So I think to succeed, ideal would be somebody from family who has the feeling of ownership, so that I can take this hospital or center to next generation, and this is my clinic kind of feeling would, I think, will always be better. So my spouse is helping in hospital, so just I told that my daughter was not very much interested in ophthalmology, but gradually sooner or later she became interested, and now she is doing fellowship also. So I helped in motivating her to go to Opthal to do PG, and got married during internship to PGT of same city, Patna. Now he's a consultant and trained vitreoretinal surgeon. So daughter was guided in such a way that if she comes, or if I manage to bring her to my place, she covers the other sub-specialty. Like myself, I take care of the anterior segment or refractive surgery. My son-in-law already we are vitreoretinal surgeon. So I motivated her to take some other sub-specialty. So you can plan in this way if your generation is pursuing some course. She is doing cornea. But as you know that when the COVID came, everything was everybody went into some kind of depression, or you can say that there was slump in everything. So I also became conservative, and at that point of time my daughter never said that I will come to Patna, because Patna, you know, is a two-tier city, and having spent at metro cities for training, these days the children, they do consider the quality of life is very important factor. So she was very much reluctant to come to Patna. So what was in my mind if none joins me? There are a lot of challenges nowadays, as discussed by previous speaker. If you have to sorry, if you want to run your hospital, there are a lot of problems nowadays cropping up, like government legislation. Every day we hear that you have to follow these norms, and that. And not only that, the patient's profiles is changing. They are becoming more and more demanding. There is a lot of cutthroat competition in the ophthalmology also. When I started, we were only few ophthalmologists in our area. Nowadays, in those areas, only 100 ophthalmologists are there. And obviously, as the things goes, some of the amount of unethical practices now has cropped up in our subspecialty or specialty also. And this is an era of digital marketing, or a lot of people are indulged in that. So what I thought that I would work for next 5 years if they don't join me. But my alternative plan was to join some chain of hospital if none of children come to my place and they go to some other place. Like sometimes they think about going to some foreign country for further training. So I don't know what, but still the things are not so clear. But at the same time, so why the next gen they don't want to come? The things which I just told you, that in two-tier city they feel that the quality of life is not good. Lot of problems are there. Lot of things needs to improve in these two cities to just attract these people. They needed counseling regarding, but they don't. At the same time, they don't see the struggle or problems they face if they go to some new places as newcomer. So they will have all the disadvantages of newcomer, and they don't understand the advantage of joining an already established center. So that has to be counseled, and how to make them happy to retain in our center is, or your center is, to give them a very good work environment, culture, equipment as per their requirement, good amount of remuneration or incentive, make them partner or shareholder, offer them some leisure trip every 6 months, so that these things can attract the children to come to even tier 2 city or 1 cities. If they join, there will be win-win situations for all of us. Like we can scale up the facilities what we have right now. Like we can provide treatment under one roof, all the subspecialty can be covered. We can expand further, and if in due course, if somebody plans to open some new center, that is possible. We can install higher machines. You know that all these times machines are so costly, and every day new machines are coming. So unless you have somebody to look after or to utilize that, then the money goes wasted. So you can add those machines if your children joins. Like I had in mind to install femtolaser, maybe flax, or to start academics like DNB courses if they join us. So these all things are there in my mind. If suppose they finally plan to come, then the next question will be, how do you want to launch your children? It's not that the moment they come, they will start having their own patient. It's very difficult nowadays to get patient. So there should be proper launching of those your kids. So you can do this by inaugurating a new facility, organizing a get-together, workshop, meeting, and you can use these situations to launch your children, so that they are visible to many persons. You can do, initially you have to promote your children so that they get the patient, because once you have established yourself as a practitioner, the patient comes by your name. वो खोजेंगे कि where is this senior doctor, so they will never go to the. So you have to promote them gradually and gradually. I think in-house promotion is the best way. You have to offer them, you have to suggest the patient for cross consultation. Like you can say कॉर्निया के बेस्ट डॉक्टर ये हैं, यू हैव एक बार उनको दिखा लीजिए. इन दिस वे यू कैन जस्ट इंक्रीज देयर पेशेंट होल्ड and this way the patient will come across, they will come to know that probably for this subject or this subspecialty, he or she is a better person. And getting referral from peer and friends, making them visible in social media or website, organizing camps, social awareness meet, or participation in the local ophthalmic and relevant scientific meets. By these all these things, the next generation can be made more visible to the surroundings. Currently, as of now, I am not yet clear whether they are going to come or not, because after this, मुझे ये करना है वो करना है. These days, all children are very much ambitious. So I don't know, but hopefully, if I get yes from them, probably I will have team of another 2-3 from my side, and so slowly motivating my son to take up ophthalmology. And I think 50% is motivated now. So maybe that my son also joins later on. If he thinks that, if he is ready that I will do ophthalmology, then I will make him to take some fellowship where I am lacking in my hospital. So you can plan or you can guide your children in such a way that you have a team of all the subspecialty. And my future plan that even if they join, you cannot take liberty to retire immediately, because you have to pass on the baton. It takes some time. So even if they join, I have to serve or I have to work with the same capacity for nearly 5 years till the patient gets transferred to them. And the retirement should be phase-wise. You can just decrease your working hours and or maybe a day. And after certain time, your role will be more of, or my role will be much more of a motivator, guide, or troubleshooter, or where I needed, I will fit myself. And if they join, I will have much more time to pursue my passion, or you can say I can enjoy my life, some of the life which I have devoted, most of the life I have devoted in my clinical practice. So I will have some chance to do some recreation and other things, and everybody would like to have their children to come to their place so that they can have some these times to enjoy. So thank you very much.